Hi, I'm Sue Elliott.
And I'm Ed Holland. Welcome to this edition of Ready, Set, No, brought to you by Informing Families, Building Trust.
In part one of this two-part series, we talked about the fact that the state is changing to a new health care system for people who are receiving SSI and on Medicaid. Not for people who are on Medicare and SSI, but people who are on Medicaid and SSI.
You know, since that first video podcast aired, we've received a lot of questions from a lot of people around the state about what this change really means to them.
My question is, why are you guys doing this?
That's a really good and fundamental question. Last year, the state legislature directed the healthcare authority to look at ways of saving money and preparing citizens in our state on Medicaid for the implementation of the national health care reform. By moving Medicaid into managed care, the thought is that we will both save money and maybe more importantly, that we will increase the access that people have to doctors who are willing to treat people who are on the Medicaid program.
My sons both have private insurance, so will this affect them since they have private insurance and Medicaid secondary?
No, this won't impact them. It only impacts people who are on SSI and receive Medicaid. So if you have private insurance and or you're on Medicare, this will not impact you.
In fact, this change will only affect the medical side of things. If you're receiving a service from the Division of Developmental Disability or some other part of the Department of Social and Health Services, those what we think of as social services or long-term care services will not be impacted by this change.
Question?
I would like to say, will these questions infect the medications and stuff?
Well, it actually could impact the medication. You need to check with the managed care entity that you choose to make sure what prescription drugs are on their formularies, because not all of them are going to be the same. So you need to make a list of all of your drugs and make sure when you check with the Medicaid organization that the managed care organization that you're going to choose, that they have those drugs listed.
Where do people turn for help? That's my question. I think this is going to be really complicated for people to get a handle on.
That's a really great question and a very important one. Everyone who is a client of the Division of Developmental Disabilities will receive a notice, and a notice will be sent to the NSA, which is the Necessary Supplemental Accommodation. The NSA is a family member or maybe a service provider or someone that you have identified that could help explain things, such as this notice. Also, Informing Families, Building Trust has developed 3 very simple, clear, straightforward bulletins that explained this change and can help people make these choices.
If I cannot find a doctor on any of the plans that are offered for me because of my son's autism, someone who truly understands his needs and the differences that he's going to have challenges with, is there a way I can appeal that decision and keep my doctor who knows him?
You can request an exemption through the healthcare authority, and there's a pretty good chance that it'll be approved. However, you have to make sure you have really good documentation as to why you need that exemption. In addition, free legal advice is available to low-income individuals through CLEAR Hotline through the Northwest Justice Project. And remember, initially everyone is going to be signed a health plan. If you don't like that health plan, you can change it at any time. But be sure that you wait for your original notice before you try to make a change.
All of the information that we provided today and through the bulletins may be a little overwhelming, and it is a little confusing to face such a big change. We hope that you will visit our Informing Families Building Trust website, follow us on our Facebook, sign up for our listserv so that you can get the current information, and we will post additional information or meetings as they happen. That's it for this edition of Ready, Set, No, brought to you by Informing Families, Building Trust.